And with the country getting closer to having a coronavirus vaccine available, the big question is, will you be willing to get inoculated? People here in Southwest Florida seem to be split, and medical experts say that's problematic because of the hesitancy will lead to prolonged pandemic. Medical experts have pinpointed some broad reasons for vaccine hesitancy, and trusting the safety is one of them. One woman tells Fox 4 she'd like to get vaccinated, but knows she'll need to wait for it.
I don't want to take somebody places who is maybe more vulnerable than me, so let the older generation do it first, or the people who work in the hospitals.
And she says she'd also like to see how that first round goes. Meanwhile, fear that the vaccine's being rushed and medical reluctance in certain cultural communities are among the other top reasons medical experts say some people are reluctant to take it. 2 U.S. pharmacy chains are preparing to give out COVID-19 vaccines as soon as there's a green light from the FDA. Mandy Gaither tells us how that distribution will work.
Healthcare workers and long-term care facility residents are set to get the first COVID vaccinations in the U.S.
Our plan is to be ready to go as early as December 15th, while waiting for the state approvals.
In October, the Trump administration announced agreements with CVS and Walgreens to vaccinate residents of long-term care facilities nationwide. The pharmacy chains already have a list of those organizations, says Dr. Troy Brennan, Chief Medical Officer for CVS Health.
We've basically got 31,000 locations where we're going to have to be doing the vaccination, and that's about 2 million patients. So we know who it is, where they are, and how many patients there are.
CVS plans to send teams to each of the facilities 3 times in the coming months. A team will consist of 2 vaccinators and 1 support staffer on average. Brennan says they're already working out details for vaccine distribution within each state and looking ahead.
Once we get into sort of general distribution, I suspect that not only ourselves and Walgreens, but there's going to be a number of other pharmacy chains and grocers who will be involved in it. And I think that using all those various outlets, we're going to have very good penetration across the United States. You'll get an appointment for both your first vaccination, your second vaccination, and then we will keep after you to make sure you come back for that second vaccination.
And he says the skilled nursing facilities have already made a decision about whether to work with CVS or Walgreens. He says the decision's based on which pharmacies are more prevalent in their area.